Okay, with me here is Bill. Where you from, Bill?
I'm from Hawaii originally.
Hawaii. So where you live right now?
I live in San Clemente.
Okay, so tell us what's your problem and why you're here.
Well, I was referred to Mr. Tong through a friend of mine who works with me in construction, and he had a similar thing. I've really been healthy my whole life up until the last few years ago, and physically my legs, this signal, I guess, from my head to my legs just isn't there. I'm constantly, wondering what foot's going to go where, and I've got to just think about what step, my right, my left, my right, my left. And it's been escalating in the last year to the point now where I can't do anything, literally.
Okay, we just take you walking. So what have you tried? Any kind of treatment?
I've been to neurologists in the regular San Clemente general hospitals and things like that, and had numerous MRIs and CAT scans.
Oh, they do a test, so nobody's going to do anything for you?
They really have no answers for what it is.
Waste of money.
And there's nothing to see. I mean, the x-rays don't show anything there because they can't see what's going on with the signals. And so I was left with no other thing than to just look outside the normal avenues.
So did they give you anything to treat? Any drugs? Any physical therapy?
They haven't given me anything other than just the advice of we'll keep looking, and like I'm dead in the water.
Looking for what?
Exactly.
Keep looking for what?
Exactly.
Okay.
And
so what's the diagnosis then?
Well, holistically looking at everything. I mean,
did they give you a name, a diagnostic name?
No. Well, okay. One thing they said was that possible MS, possible...
It's a waste of time.
Yeah,
I don't need the name, okay?
Exactly.
I'm going to try to get you better this treatment, okay? And then we'll take you afterwards, okay? So that's the only thing you have. You have a little sciatic, a little low back pain, but other than that, you never have. But this is serious.
Right now I feel like I could sprint across the room, but I probably wouldn't make it to that tile.
And it's getting worse, right? You told me
it's getting. It's to the point now. 3 days ago, literally, I fell 5 or 6 times in one day. I mean, I pretty much fall once a day, but this was like one after the other after the other.
Okay.
My friends are all to the point, because I'm usually the go-to guy to fix everything and do everything.
Okay.
When they see me down like this, it's like, this is crazy. And my head, because I'm a really positive person, I want to just go and fix and do. And so even when I'm on the ground, I'm working on my friend's motorhome, crawling around the motorhome all day because I don't want to get up and fall. And I just...
Without my treatment, you'd be crying all the time.
I'm going to tell you, man, it's that point, I'm really... Anything is a positive.
Okay, let's give you the treatment now. We'll see what I can do, okay?
Okay, Mr. Tong.
Yeah, okay. Okay, I want you to stand on your left leg first. Which leg is worse?
This one.
Oh, this is a better leg, okay. Use your hand and try to bend, yeah.
No, if I just bend it, I'm going to hit the ground. I can't.
Oh, I see, you cannot bend?
I have to lock my leg up straight, or otherwise I'll just fall.
And the left is worse?
The left is the worst. The right one, I might be able to get a little out of it, but as soon as it gets past that, it just wants to just fall.
Okay.
I don't have that muscle it takes to keep it pushing up.
Okay. And the left one,
the left one is bad. Like, if I put them on both, I can go to about...
Okay. Okay, like this.
That's
okay,
right.
okay.
Once it gets past that leg,
okay.
I just wants to get out.
And the left one you cannot bend by yourself at all?
No, I can lift it this way, but I cannot, it doesn't go backwards.
Or it doesn't go backwards?
No, I got to drag it to get it to go back.
Okay.
I can move it forward, but I can't.
Okay, how about the right one?
The right one is a little better. I can go forward and back.
Okay. Try the left one again.
I can only go forward.
Okay.
This one, if I try to pull it back, it doesn't. It's just dead. It doesn't
all right.
want to go anywhere.
Good. All right. Okay.
Literally, I kind of just throw one leg out there and land on it.
Now, I want you to lift your right leg. Lift it. High.
That's about it. Right.
That's about high? Okay.
That's as high as I can go.
Okay. How about...
If I break the knee, I can do it.
Oh, I see. Okay.
I can do it like that.
Okay, straight you cannot. Try again.
No way, straight.
Straight, try again.
That's as far as it goes.
How about the left one?
It's even worse. This one. That's about it.
Okay.
But if I break it,
okay.
I can kind of see it doesn't even want to. Just received my first treatment from Dr. Tong, and before, my feet were completely cold, and I had no relative feeling at all. I couldn't even move my toes or anything, and I could feel them again completely. And I mean, as far as lifting my leg, I can move it.
Could you do this before?
Never. The last 5 months have just been from pretty much about here down. It's been cold and numb. And
now put the left foot down and then lift straight your right one.
This one.
Oh, gee, that's pretty
and
good.
I couldn't do that before.
Yeah, that's much better.
Much better.
And I did not.
I mean, that's remarkable.
Yeah, I just treated your left one only.
This is the left leg. This one here, however, feels like it's had some kind of. He's got something going with the bloodstream for sure. My feet are not cold anymore. It's just amazing.
Try to lift up your left one a little bit. Yeah, you could do it.
I mean, I can feel it. That's the main thing. I mean, I know my muscles are fatigued from not exercising, but even just moving it at all, that's like right there. That's just amazing. I mean, now at least the muscles they've got a chance at getting stronger from. That's just amazing. I can feel my toes again.
This is your first treatment.
And yeah, I mean.
Okay, move the right one again.
And this one here is.
Yeah.
I mean, I can lift. That is amazing. I could not do that before at all. At all.
Okay, we're gonna have you come down and walk. Okay, Bill, how your feet feel now?
Before they were cold and curled as if the blood wasn't in them anymore, and now they're bright red and they're totally, I can feel the blood flowing in them. And I mean, like I said, this is just a one treatment, but I mean, it's like a whole different feeling. I can tell there's the blood flow has certainly changed completely. I can feel my feet again. And I mean,
Let me, wait.
Now
Okay, say again.
My toes were curled before, curled up, and cold, completely cold. And now my feet are bright red, and I can feel my toes again. And like I said, the muscles haven't been used for so long that they're a little weak, but at least I know where they're at now, and there's something to be said for that. It's just amazing.
Now, can you move your feet back, the left one?
My left foot.
A little bit better than before.
Oh yeah, before.
Yeah, before you gotta move it back, right?
No, not at all.
Yeah.
This one here is just. It's hard to hold my body up on it. Like I said, my legs are. This muscle in my calf in my thigh is so weak from not using it over the past year that it's like I don't feel confident enough to stand on one leg anymore. I mean, if I'm just even.
Oh, this is pretty good. A lot better than before.
There's a huge mindset difference here, because before my mind was, I can't feel anything from here down. Now my mind is, I can feel it. I'm not really sure about what to do with it, but I can feel it now, which is just a completely different thing now. I feel way more confident about it. I just have to. See, I couldn't do that before at all.
Oh yeah, you can walk backwards, yeah.
Backwards.
Yeah.
See, now I'm feeling like there's something there. The signal, I can go, okay, there's my foot, and now it's there, and I can kind of move it. Before.
I connect the mind back to your legs.
Definitely.
Yeah.
The mind, I'm connected to it now. I feel it again. Now it's just a matter of, I can see I can move it now.
Within a few treatments, you'll be able to walking much more normal.
Just for one treatment, I'm going to tell you, it's a miracle. I was pretty much about ready to cut them off at the knee and put prosthesis on there, just because if I couldn't feel them, at least I'd be able to look at pretty plastic feet. It's just an amazing thing. There's something to be said for the pain factor. The body's an amazing thing when you can feel something there, whether it's there and 100%. Just the fact that I can feel it again is just amazing. I've forgotten what it was like to feel my feet.
And this is just one treatment, the first
That's
treatment.
it, yeah.